In 1997, Purdue Pharma's own sales representatives filed internal reports. OxyContin was being crushed and injected across Appalachian communities. The company read them and buried every single one. 500,000 Americans are dead. The Sackler family extracted $10 billion before the company collapsed. Not one of them has ever been criminally charged. So why has nobody ever told you that part? Most people know the broad strokes. Purdue Pharma made OxyContin. The opioid crisis happened. The company eventually went bankrupt. The story gets packaged as a tragedy, a drug that escaped control, a crisis nobody predicted, the pharmaceutical equivalent of a wildfire that spread too fast to stop. That's the version they wanted, and for nearly a decade it worked. Purdue wasn't the villain. They were a family-owned pharmaceutical company solving America's chronic pain problem. Medical conferences hosted their speakers. Doctors wrote their prescriptions. The FDA signed off. Everything was above board. Everything was legitimate, or so it appeared. OxyContin launched in 1996. The central claim, the entire sales pitch, was a single specific promise. Because the drug released slowly over 12 hours, it was less addictive than traditional opioids. Purdue built their empire on that sentence. They trained thousands of sales representatives to deliver it. They paid for studies that appeared to confirm it. They got that message in front of 700,000 physicians by 2001. The problem was they already knew it was wrong. Inside the company, by 1997, field reports were coming back. Patients were figuring out that if you crushed the tablet, the 12-hour release mechanism broke. The full dose hit at once, and it hit hard. Users were chewing it, crushing it, dissolving it. Word was moving through rural Virginia, Kentucky, and Maine faster than any marketing campaign. The internal term appearing in those reports was abuse potential. Purdue's own people were writing it down. Management reviewed those reports, and then chose to keep selling. What followed wasn't neglect, it was a system. Purdue expanded their sales force. They paid doctors to stand at medical conferences and argue that opioid addiction in pain patients was overblown. They coined the phrase pseudo-addiction, the idea that if a patient seemed addicted, they probably just needed a higher dose. That term entered medical journals, medical schools, treatment guidelines. The FDA was technically watching, but Purdue had cultivated relationships inside the agency. The lead FDA reviewer on the original OxyContin approval, Dr. Curtis Wright, left the FDA in 1997. He was hired by Purdue months later. The label that downplayed addiction risk, the one that went out on every bottle, was the label he had approved. They didn't just bury the problem. They built a wall around it. But that's not even the part they really didn't want out. In 2001, facing mounting pressure and early lawsuits from State Attorneys General Richard Sackler, then president of the company, sent an internal communication that would not surface publicly until sealed court documents were released years later. In it, he wrote that the company needed to hammer the idea that addicts, not the drug, were responsible for the crisis. Shift the blame. Make the victim the story. Make the addict the problem. That strategy became policy. Purdue hired a public relations firm. They launched campaigns positioning OxyContin users as criminals diverting medication, not patients who had been handed an addictive drug with a false safety label. Local law enforcement was steered toward pill mill doctors and street-level pharmacies, while Purdue's wholesale distribution operation, moving hundreds of millions of pills, stayed invisible. The numbers inside the company told a different story. In 2001 alone, Purdue generated over $1 billion in OxyContin revenue. By 2010, OxyContin had generated $35 billion in cumulative sales. The Sackler family, who owned Purdue privately, had been pulling money out, not just in salary, but through a distribution structure that sent cash directly to family members. By the time the bankruptcy was filed in 2019, they had removed an estimated $10 to $12 billion. The company went bankrupt. The family kept the money. In 2007, Purdue pled guilty to federal misbranding charges. The fine was $634 million. 3 executives pled guilty to misdemeanors, not felonies. No prison time. One of those executives had previously served as a United States attorney, which is the kind of resume that tends to slow down federal prosecutors. The Sackler family was not charged. They were named in lawsuits but protected by Purdue's corporate structure. The bankruptcy settlement included a provision that would have shielded the Sacklers from all future civil suits, even though they were not personally in bankruptcy. A federal judge initially approved it. The Supreme Court blocked that clause in 2024. A revised settlement followed. The family paid roughly $6 billion, from assets estimated at $11 billion. They paid slightly more than half of money made while people died. The opioid crisis has killed over 500,000 Americans since 1999. Overdose deaths hit record highs in 2023. The drug has changed. Fentanyl now, not OxyContin, but the infrastructure that allowed it is still standing. The hollowed-out communities, the regulatory gaps, the corporate structures designed to insulate wealthy owners from the consequences of decisions made in their names. Purdue is gone. The Sacklers are not. And the question no one in Congress, no one at the FDA, no one in any courtroom has ever fully answered is how a family can oversee the deaths of 500,000 people, extract $10 billion, and walk away with a negotiated check. Who exactly is that system still protecting?